Mr. Speaker, I rise today to talk about how Obamacare will hurt my state and ultimately hurt my patients. And I'd like to start with an example of the Medicaid program. As a cardiothoracic surgeon in Evansville, Indiana, I see a lot of patients from neighboring states because we're right in the corner next to Illinois and Kentucky. Many of these patients are Medicaid patients and without treatment face grave results. However, every year, the Illinois Medicaid program runs out of money in September, October. They don't have enough money to fund the entire year. And what does that mean? That means that without denying any patient's care that they need and deserve, my practice was forced to delay billing to the Medicaid system of Illinois. And then once the new fiscal year came into play, about 50% of those claims were subsequently denied by Illinois Medicaid. So those patients that came over for our services, they don't have quality health insurance, Mr. Speaker. Some physicians in my community don't even bother to bill the Medicaid program in some states at all. This is an example of the broken Medicaid system, a system that has many issues focusing on the access to quality health care. And it was said earlier, you see the outcome difference between Medicaid and private insurance patients because we have an access and quality problem with these patients. A system that Obamacare will break even more by adding millions of Americans to the state's Medicaid rolls. It's estimated that this may cost the state of Indiana as much as $3.6 billion to cover these folks. From Indiana, we have an innovative and effective solution, and that's called the Healthy Indiana Plan. Beginning in January 2008, uninsured Hoosiers between the ages of 19 and 64 started enrolling in this plan, a consumer-driven health care plan. Mr. Speaker, I ask unanimous consent to enter the Healthy Indiana Plan fact sheet into the record.
Without objection.
Thank you. Healthy Indiana Plan operates on an 1115 demonstration waiver from CMS, the Center for Medicare and Medicaid Services. Due to the program's success, the state of Indiana would like to use the Healthy Indiana Plan as a coverage vehicle for the newly eligible population under Obamacare. This has been requested by my state of Health and Human Services, but to this point, we've not heard a response about whether this will be possible. And I'm hoping that we get a response in the positive direction because this is a great program. The plan is for citizens that earn less than 200% of the federal poverty level and works on a sliding scale for individual contributions based on the ability to pay that cannot exceed more than 5% of his or her gross family income. Each participant is enrolled in a health savings account valued at about $1,100 and will not make co-pays except for non-emergency use of the emergency room. And believe it or not, this program reimburses providers at a Medicare, not Medicaid level. This gives citizens a financial incentive to adopt healthy lifestyles and personal responsibility to make their own health care decisions. Healthy Indiana Plan is an innovative, market-based, consumer-driven health care plan that is working. In a recent survey, 94% of Healthy Indiana Plan participants are satisfied with the program, and 99% indicated they would re-enroll. There's data in the fact sheet that I've included in the congressional record showing the success of this plan, both for patients and both for the state of Indiana. It's a common-sense, market-based solution to a broken Medicaid system that Obamacare does nothing to fix, but only further burdens my state and all states, and will ultimately continue to hurt patients' access to quality health care in America. So I would urge everyone to review what the state of Indiana has done with its Healthy Indiana Plan. And with that, Dr. Gingrey, I yield back my time. Thank you.